You have 4 patients, but only one can be seen first. Who do you pick?
Question 1. A nurse has 4 patients. Who should the nurse see first? A. Patient with BP 150/90 and headache. B. Patient with chronic obstructive pulmonary disease with O2 sat 88%. C. Patient post-op day 2, reporting pain 710. D. Patient with diabetes, mellitus with blood sugar, 250. Question 2. Which patient should the nurse assess first? A. Patient with fever, 100 nomograph. B. Patient with chest pain and diaphoresis. C. Patient with nausea. D. Patient with constipation. The nurse is caring for 4 patients. Who should the nurse assess first? A. Patient with stroke who arrived 3 hours ago with slurred speech and right-sided weakness. Blood pressure is 190/100. B. Patient with chronic obstructive pulmonary disease on 2L oxygen with O2 saturation of 90% and mild shortness of breath. C. Patient post-operative day 1 reporting pain 810 with stable vital signs. D. Patient with sepsis receiving IV antibiotics with BP 9260 and HR 110. Question 4. Which patient requires immediate intervention? A. Patient with potassium 3.5 B. Patient with potassium 6.2 C. Patient with sodium 140 D. Patient with calcium 9. Question 5. Which patient should the nurse see first? A. Patient with asthma, wheezing and difficulty breathing. B. Patient with mild headache. C. Patient with UTI. D. Patient with sprained ankle.
Question 6. The nurse is assigned to 4 patients. Which patient should be assessed first? A. Patient receiving morphine IV who is difficult to arouse, respiratory rate 8-in, oxygen saturation 89%. B. Patient with chronic obstructive pulmonary disease on 2L nasal cannula with oxygen saturation 90% and mild dyspnea. C. Patient with hypertension and BP 182/96, complaining of headache. D. Patient with sepsis receiving IV fluids with BP 94/60 and HR 110.
Question 7. The nurse is assigned to 4 patients. Which patient should be assessed first? A. Patient 4 hours post-op receiving hydromorphone who is drowsy, respiratory rate 10 oxygen saturation 92% on 2L nasal cannula. B. Patient with heart failure with crackles, 2+ edema, and shortness of breath when lying flat. C. Patient with diabetes mellitus who is sweating, shaky, and has a blood glucose of 60 mg DLD. Patient with sepsis receiving IV antibiotics with BP 90/58 and HR 118. Question 8. The nurse is caring for 4 patients. Which patient should be assessed first? A. Patient with pulmonary embolism reporting sudden shortness of breath, HR 122, and oxygen saturation 90% on room air. B. Patient with diabetes mellitus who is confused with blood glucose of 52 mg DLC. Patient 1 day post-op with temperature 100.8 degrees and surgical site redness. D. Patient with chronic kidney disease with potassium level of 5.9 and no symptoms. Question 9. The nurse is assigned to 4 patients. Which patient should be assessed first? A. Patient with anaphylaxis, who received epinephrine 10 minutes ago and now has decreased wheezing, but reports throat tightness and difficulty swallowing. B. Patient with asthma with expiratory wheezing and oxygen saturation, 91% on room air. C. Patient with sepsis receiving IV fluids with BP 8854, HR 120, and warm skin. D. Patient with diabetes mellitus who is confused with blood glucose of 48 mg/dl. Question 10. The nurse is assigned to 4 patients. Which patient should be assessed first? A. Patient with gastrointestinal bleeding with hemoglobin 7.2 g/dl, BP 98-60, HR 110, and reports dizziness when standing. B. Patient with pulmonary embolism receiving heparin therapy with oxygen saturation, 92% on 2L nasal cannula, and mild shortness of breath. C. Patient with chronic kidney disease with potassium level 6.1 and peaked T waves on ECG. D. Patient 1 day post-op with pain 910 and requesting medication.